Well, welcome to Center of Balance Life. My name is Kenny, the acupuncturist and Chinese medicine practitioners from Center of Balance. Today, I'm going to talk about how to use acupressure points to help injury of the shoulder. If you are watching, please give me a thumbs up, like and share our daily free for all DIY acupressure topics. Do you or do you know anyone who suffers from injury of the shoulder? If you do, please type 1. As usual, do you have any of these 3 tools? 1 can be your fingers, so it's either your thumb, index finger, or middle finger. 2 is your knuckle. So you bend your index finger and with your thumb supporting it. Number 3, it can be a massage device or some small rounded tools. Okay, this is an acupressure pointer or massage device. So any of these 3 can be used to locate the sensitive point and apply pressure for 30 seconds. Rest or release for 5 seconds, and then you apply pressure at the same sensitive point for 30 seconds. You rest again for 5 seconds, and you repeat the process at least 3 times per point. Then you move on to the next sensitive points, repeat the same process for 3 to 5 times. You can do it daily or throughout the day. Shoulder is one of the most mobile joints of the body, with multiple structures and muscles contributing to the area. And due to this, shoulder pain is one of the most common complaints and can impact many aspects of our daily life, whether it's working, driving, or sleeping. Shoulder pain can be caused by an acute injury, chronic condition, overuse, arthritis, or degeneration of tissues over time. Let's quickly talk about the anatomy of the shoulder. Shoulder is generally said to be the ball and socket joint, it's right here, and has a high level of utility and mobility because it is made up of several bones and complex system of muscle, tendons, the fluid-filled sacs that provide cushioning between the bones, which is known as the bursa. And there are 3 joints that make up of the shoulder. The first one is the Acromioclavicular Joint, which is known as the AC joint, where the collarbone and the shoulder blade meets. Number 2 is called the Glenohumeral Joint, where the ball-shaped head and the long arm bone, which we call it, the humerus, fits into a shallow socket called glenoid. The third one is sternoclavicular joint, where the clavicle meet the sternum. These bones are held together by the rotator cuff muscle group, which is a collection of 4 major muscles and tendons. The unique construction of the shoulder, surrounded by muscle and tendons, as mentioned earlier, to provide stability, and when these soft tissues are injured or weakened over time, the shoulder becomes unstable and or lose part of that mobility. What are some of the common shoulder pain? So, number 1, the torn rotator cuff. A tear or tears in the muscle and or tendons of the shoulder joint trigger a dull pain that can be worsened when you sleep on it and can be very difficult to perform daily simple tasks. Number 2, the frozen shoulder, also known as adhesive capsulitis. When the capsule of tissue surrounds the shoulder joint become tightened and more rigid, creates stiffness and severe pain in the shoulder and arm. Number 3, tendonitis when the tendon that attach to the muscle of the bone of the shoulder joint become inflamed, and with the feeling of tenderness and achiness and the usual activities or movements, that performing daily tasks can be difficult. Number 4, bursitis. When that small fluid feels sick, called bursa, become inflamed, and again, either due to injury, repetitive motion, or other condition that can affect us doing daily tasks, and even with small movements such as pushing the door or turning the doorknob can hurt too. Number 5, arthritis. When the cartilage and the synovial lining that lubricates the joint begin to wear away gradually. That's when the bone of the joint begin to rub against each other because of change of shape. And with deep aching sensation, sometimes can get worse when the weather changes, such as cold, rainy day. Shoulder impingement. Some of the muscle and tendon tissue of the shoulder is cramped between the bones, which can trigger pain. This can be caused by swelling of those tissue due to overuse, or a tear in a tendon or labrum, or the shape of the bone change due to arthritis. In some cases, congenital shape of the acromion or the bone spur could also cause this impingement problem. Dislocation. When the upper arm bone pop out of the socket bone. This can happen when the arm is suddenly pulled or twisted sharply, or fall on the outstretched arm. It can cause very severe pain, swelling, bruising, even the loss of mobility. Once the displaced arm bone is reset in the socket, mobility can return, but it does take a while to regain the strength as well. Other shoulder injuries include separation, broken collarbone, labral tear, a pinched shoulder nerve in the neck area that can trigger radiating neck and shoulder pain, or a muscle pull in the upper back, such as either your trapezius, your rhomboid pain, or the top of the arm. Problem with jaw or TMJ disorder can also contribute to shoulder pain. The best way to relieve or to prevent shoulder pain from recurring is to manage the inflammation as usual. Regular acupuncture treatment can also be very, very beneficial. There are also some excellent self-care techniques such as acupressure that you can use to relieve pain and improve the functions. What are the acupoints that you can do to help yourself? Please don't forget to like and share, and most importantly, show us some love by giving us a thumbs up. Right, remember, if your pain is on the right side, we're going to use the left side to treat. Okay, if your left is in pain, we're going to use the right side to pain. Okay, if one side is, if the opposite side is not working, well, then try the same side. Okay, so vice versa. This time, say the shoulder pain is on the right side, I'm going to use my left leg. Okay, let's find our leg. This is my leg. We're going to use the outside of the leg. Okay, so we're going to find our leg. We're going to halve it. We're going to find the top of your ankle, and we're going to find the joint here on the knee. Okay, we're going to halve this. Okay, and this is how far we will be doing our acupressure. So till the halfway of your leg. Okay, so the first area on the anterior, which is the front of the lower leg, 4 finger length below the kneecap. Okay, so find the kneecap, 4 fingers down. It's around here. Okay, and then 1 finger breadth from the anterior crest of the bone. Okay, so you mark the 4 fingers down, and then the bone here, so 4 fingers down, starting here. Okay, directly across there. We're gonna start using either your finger or your massage device. Press and check if any tender spot, and once you find that sensitive spot, give that spot a 30-second massage. Okay, you release and rest for 5 seconds, then you massage the same spot again. You repeat this 3 times. So massage, rest, massage, massage, rest, massage, massage, rest, massage. Okay, and then you move on after finishing that point. Keep checking, keep massaging once you find a sensitive spot, all the way till the halfway of the leg. Okay, so along this line, the straight line, find a sensitive point. Okay, remember 4 fingers down from the kneecap and 1 finger breadth from the crest of the bone. Okay, now the second spot, this time we have to find the head of the fibula in the depression just at the front and below the bone. Okay, head of the fibula just below the kneecap. You can see a rounded shape here that is showing up. So this is the head of fibula. Okay, so I have to find the front of the fibula and just below the kneecap. Oh, sorry, not the kneecap, the head of fibula. Okay, same thing. Within this area, use your finger or massage device. Press and check for any tender spot. And once you find a tender spot, you massage 30 seconds, release and rest for 5 seconds, and then you massage again. You repeat this 3 times on the same spot. Okay, so once you finish, you continue down. Okay, just continue down. Again, a sensitive spot, massage again. Okay, after you finish 3 times, you can continue again all the way down to the halfway of your leg. Now the last zone is just at the back of the knee, so you can see. So it's at the back of the knee. I'm just going to use the bowl. Okay, so at the back of our knee, on that crease line, okay, in the depression between the 2 tendons. Okay, so you go to this either side of your knee, back of your knee, you will feel 2 tendons. Okay, there's a crease line there in between the 2 tendons, right in the middle. Okay, right in the middle at the back of the knee, between the 2 tendons. Okay, till halfway to your knee, so it's almost to your calf muscle. Okay, we're gonna start palpating either with our finger or massage device. Okay, you start pressing. Okay, sensitive spot, massage 30 seconds. Okay, and then you release, you rest again, same spot, 30 seconds. Okay, you repeat this process 3 times. Once you finish 3 times, you move on, keep checking, keep massaging once you find the sensitive spot within this whole halfway of the leg. Okay, all the way down, halfway. So this will, all these points within this area will cover your 3 channels on your arm or your shoulder. Remember, you want to massage all these sensitive points every day, or at least once a day. Even better, while you're massaging the sensitive spot, can try and move your shoulder. Okay, don't force it, just move slowly. Some of these points may not work for you. we, traditional Chinese medicine practitioner and acupuncturists, has a lot to consider it. Along with your presenting signs and symptoms, we ask questions regarding your appetite, your diet, your energy level, possible bowel, urination habits, how your tongue looks, how does your pulse feel like. All these pieces of information could be trying to tell you and us how to bring your whole body back to balance. Hence, it is important for us to do an initial examination to come up with the best possible tailored care plan specifically for you. So please don't hesitate to call us or email us info@balancetcm.co.nz to book an appointment. We have 3 clinics in 3 different places: Hamilton, Raglan and Auckland. My name is Kenny. That's all from me today. If you like or enjoy our daily life, please give us a thumbs up, a like and share. Thank you for joining us. I look forward to seeing you guys again. Stay awesome.